Welcome to Impact OC, the only program showcasing the people and organizations shaping Orange County. With your host, Don Camber.
Hello, live from the OC Talk Radio studios at UCI's Beal Applied Innovation Center. I'm OC Talk Radio Public Affairs Director Don Camber with another great guest positively impacting our community. Today I welcome Share Ourselves Chief Executive Officer Christy Ward. Share Ourselves is a healthcare organization that provides comprehensive health and support services for the entire community. It stands as a beacon of compassion, particularly for those facing the challenges of homelessness and low-income people. Thank you, Christy, for being on Impact OC.
Well, thank you, Dawn. It is such a pleasure to be here today and be able to talk about our organization and the impact that we have here in Orange County.
Well, Christy, please share with us the history of Share Ourselves and the inception of the organization and the call to action.
Yeah, thank you so much. Well, Share Ourselves was actually the inception of that started in 1969 in Costa Mesa, where there was a group of parishioners at a local church who were identified needs of farm workers who were living in what would be considered deplorable conditions. And they started gathering items, food items, clothing, etc., for those folks to be able to have what they needed, and they would drive them to church. And that was the inception of the development of the nonprofit that then became a 501c3 in 1970. And from that point forward, in 1970, we became an organization strictly through volunteers that was collecting food, clothing items, and a variety of other things to be able to provide to people in need in the community. In 1984, what was really interesting, so that was 14 years after the organization had been operating.
Was it called Share Ourselves back then?
It was called Share Ourselves back then. Also was known as SOS, so some folks may know us from that name as well. In 1984, there was a physician that was also volunteering who said, gosh, you know, these folks have medical needs. And so with the support of Hoag, we had a physician who started to provide free medical care. And then a dentist in 1987 said, gosh, these folks have dental needs, and propped up a free dental clinic. And it just kind of had the ball rolling from there. And then we were always doing food and food distribution and these other services, helping people with housing and utility assistance, as well as providing free care. And then the organization had an opportunity in 2012 where there was some funding opportunity through the federal government to become what's called a federally qualified health center. And what that is an organization that provides health services to anyone in need, regardless of their ability to pay. And so in 2012, Share Ourselves became a federally qualified health center. And today we now have 8 sites across Orange County where we provide comprehensive medical care, and that is pediatric through senior care, and it involves all kinds of services from routine physicals, chronic disease management, illness, sick visits, and we also then provide dental services that is for children and seniors. We're doing routine dental care, as well as things like fillings and extractions. We do provide some dentures and other types of things that people need, because when we think about comprehensive health, if you don't have good dental care, it's hard for you to have good physical health too. Beyond that, we do have a pharmacy that we run. We have behavioral health services that are integrated, so we are able to address depression, anxiety, other types of barriers to care within our organization. And then we still are providing those core services that goes back to the legacy of our organization, the foundation, which is helping people if they're food insecure, through our food pantry that runs Monday through Friday in Costa Mesa. We still provide some financial assistance and a lot of navigation for people who are experiencing homelessness or who are at risk for being homeless. We know that if through the work that we do, we're able to take people in whatever situation they are and try to move them to a different place. Whether or not that is that they are homeless and we're able to help them get into a situation where they have housing, or whether or not they are at a point that they may become homeless, but we can keep them from that state. So, and then beyond that, we care for people on an ongoing basis too. So we are the primary medical home for about 14,000 people right now in Orange County.
You said you have 8 sites.
We do. Yeah, so we have a location in Mission Viejo where we provide medical and dental care. We also are in Santa Ana. We have a medical clinic there. We are in Newport Beach. We have a pediatric dental care site there, as well as a pediatric and obstetric clinic where we provide care to pregnant women. In Costa Mesa, we have 2 locations. One is our big hub where we have all of our services, and then we have a new site that we just opened that is on the is in partnership with Newport Mesa Unified School District, and so we're providing care to children and adults in that community. And beyond that, we have a mobile health unit that does go out to some shelters in Costa Mesa and Huntington Beach, and we have a very small clinic that is embedded in a homeless shelter in Anaheim.
Wow.
Yeah.
So what are the demographics of the people you serve?
You know, it's all ages. I would say the majority of folks that we see are Spanish speaking. The Latinx community makes up about 65% of the folks that we see. But we see everyone in the community, regardless of, who they are and their income level. Part of being a federally qualified health center is we see everyone regardless of their ability to pay. So there's a lot of work that we do to, if folks come to see us and they don't have insurance, we have folks that will go through and screen them to determine, are they eligible for Medi-Cal? Are they eligible for things like CalFresh and other services that may be available to them that they may not know about. Yeah.
So therefore, you really are there for the community, but still they need to go through the process to qualify.
That is true, although there isn't any situation that we would say that you couldn't come to see us. So if someone doesn't have insurance, what we do is we have a sliding fee schedule that is set up based on someone's income or a family income, and then we provide those services based on their financial situation. We will never turn anyone away for inability to pay. So if, for example, someone doesn't, we ask them to pay a certain amount. If they don't have that amount, we will still provide those services regardless, again, of their ability to pay, and we will never send anyone to collections. So that's never a concern if anyone comes to see us.
Do you have fundraisers?
We do have some philanthropic support of the organization. We do, our funding comes from a variety of different places. So some of that comes from billing insurance for things like Medi-Cal, for the patients that we see that do have Medi-Cal, or commercial insurance or Medicare. We do bill for those services, but some of our funding also is through philanthropic support, through grants that we apply for. Not all of the things that we do are covered. And so what I mean from that is a lot of the services like our food pantry, our homeless navigation, we do provide interpretation, and our folks that do eligibility screening, those types of services we're not able to get reimbursed for. And so there are things that we need to be able to have some funding to be able to supplement.
Sounds like you need the community to help you.
Community support is always something that is very important for organizations like ours. As in our community, unfortunately, in Orange County, 1 in 3 people live at or below the poverty level, which is pretty incredible for the number of folks in our community and what many people perceive of Orange County being very affluent, which certainly there is that. But the need is continuing to grow. And so, unfortunately, the need for us to continue to grow in order to be able to provide more services to more people in our community is that's just a constant.
And you have the capability to do that?
We do. Yeah, we continue to grow as an organization. Um, what we're trying to do is make sure that we're opening locations where we can see more people, which in turn means that we're able to bill for more services through Medi-Cal. And that also then allows us to um, be able to grow, if that makes sense.
Can you share with us some stories of people who've been through your program?
Gosh, there are so many great stories, some of them very sad, but really good. We have, and on our website, there's some of these stories that are highlighted, but there's one person that really comes to mind when I think about it. It was someone who was experiencing homelessness and really struggled for years. And through the support of our teams, we have case managers and folks that helped her get into this particular person, helped her get medical and dental care that she needed because she really had a lot of oral health issues. But beyond that, they were able to support her with being able to get into housing, being able to get some treatment that she needed for substance use. And we were able to change the trajectory of her path. And so it took her about 12 years to get housed, but she now is housed and is in a completely different situation. And it was through the support of our team that happened because of the support of a lot of our generous donors that really have helped us do that work and provide those people to help.
And the donors help because?
Well, I think that there are a lot of folks in our community that are always looking for ways that they can be of assistance. Sometimes that's financial assistance, that we're able to hire people to provide services that we wouldn't be able to otherwise provide because we can't bill for those. There are some really interesting programs too that Share Ourselves does every year that our donors are also and volunteers are also really integral to. And so we have a program called Adopt a Family, which happens every holiday. This year we'll be celebrating year 55 of that event, but it's where we have the school districts and agencies in Orange County identify families in need in the community. And what we do is we provide those families to be adopted by donors who are interested in providing gifts, food for these folks during the holidays. And so for perspective, on a yearly basis, we have about 1,200 families that get adopted. And last year, we helped about 5,600 people be able to get gifts and food for the holidays. And that only can happen because of the generous support that our donors have of coming in and adopting families.
Well,
and
how
just
can
giving
people get in on
generously.
that if they want to help?
Yeah, on our website, we have information about Adopt a Family. Every year it's posted, so we are just ramping up for that now. We also, throughout the year, we just got done with a big backpack distribution where we distributed 2,000 backpacks to fully packed backpacks with all the supplies to kids in the school districts. Here in August, we're going to do a big Thanksgiving distribution of turkeys and food during that time. We also have some other programs called, one is called First in Family, where we help sponsor some children who are first in their family, or they're seniors. They're, kind of adolescents at that point, right? Who are going to be first in their family to go to college. And so we support them with a small scholarship and with supplies and a sweatshirt from the school that they're going to go to. And many of them wouldn't be otherwise scholarship eligible. And this is, again, a way that we're able to bring volunteers and donors in to be a part of helping out. Because I think, again, there are a lot of people who are looking for ways to help people in need in the community. And I think one of the great things that our organization has done over the, almost 55 years that we've been in existence is really trying to pair up the needs in the community with the people who are wanting to be a part of that solution.
Well, share with us what it's like for a volunteer to be involved. And I want to really talk about the adoptive family, because I would imagine, do they get to see what it's like for the family to see all the gifts you give them?
Yeah, so there is the way that we do that event is, it is a very heavy volunteer driven program. We hold so the families get adopted, and then we have a big event where we collect all of the gift items at the OC Fairgrounds in December. And so we fill two of those large buildings full of toys that are going out to the agencies. The agencies actually are the ones that deliver the toys to the families, the toys and gifts to the families. But we have this, the volunteers and donors are able to come by and see all of these gifts and bikes and all of these things that are going to go out to those families. And there's also an area where we have a lot of folks where we have some unadopted families, and so we have this gift wrapping area. We call it Santa's Workshop, where people can come and see gifts being wrapped, or they can come and, if they want to volunteer some time to be a part of that. It's just a really fun event. Really puts you in the holiday spirit.
Do you see younger people, like kids, get involved with the volunteering as well?
Very much. Yeah, we definitely do. And throughout the year, we have volunteer opportunities almost on a daily basis in our food pantry in Costa Mesa. But throughout the year, we engage a lot of organizations that are interested in volunteering, where they either come in as groups. We have some corporate groups that even come in to help with that, or groups that are just interested in putting together things like what we would call hygiene kits, where there might be, soup and soap and shampoo and conditioner and a toothbrush and toothpaste, little.
Is that for the unhoused?
Yeah. And so what we're able to do is give those out to people who may come by and be in need of those throughout the year. And so there's volunteer opportunities that happen at these specific events throughout the year, but on an ongoing basis too. And we've found that we've been able to really engage not only adults in the process, but there are a lot of groups, National Charity League, and some of the local clubs. We have a couple clubs in Newport Beach that I think of, where there's a teen group that comes together, and they're always trying to put together some items for folks in need. So food drives.
Yeah. Are there other organizations like yours?
There are other organizations. We are doing a lot in the community, and it certainly isn't to say that there aren't other organizations like ours that are also running food pantries, but the breadth of what we're doing is pretty unique. And so in addition to providing all of these complement of health services that we provide, then having the food pantry and the housing navigation and some of those financial assistance programs for utilities and those types of things is something that not every organization has. What I really appreciate about our ability to do that is when we think about however people come into our organization, whether that's they're coming in because they need health services, or they're coming in because they need food, what we can do is identify what other needs do they have. If people are food insecure, the likelihood is that there are other challenges that they're having, and we can have those conversations and be able to help create those links to everything else that we provide. So I always like to say that every door is the right door to be able to understand the comprehensiveness and make the connections to what people need.
So you're able to make them whole.
As best as we can, absolutely. That is our goal, is to try to plug in uniquely to that individual or that family what they need so that we can help them get to a better state of health.
When it comes to healthcare, do you find people still on the system for years?
Oh yeah, for sure. I think that that there are a lot of barriers in play that sometimes people have health barriers that are going to keep them in a place that would take them a little bit longer to get out of, right? So through the help of our team members who are looking again at those unique situations, it may be that we need to bring other resources in or help them make connections to other agencies that can help them. I'm thinking of a couple of situations where we have some folks who became disabled and were unable to work. And what we're gonna do in terms of trying to connect them to resources is gonna look different than perhaps a family that is needing to get assistance in finding housing. Those resources are going to be different. And so what we're doing is navigating how we can help either with the resources that we have internal within our organization or working in partnership with other agencies.
How do the recipients feel about the help that you're providing?
There's a lot of gratitude, and I think that that's what keeps us all so highly engaged in the work that we do. I say it a lot. I feel like I have one of the best jobs because we get to do community service as our daily work. And, it's great. I think especially sometimes with folks who are experiencing homelessness in particular. And sometimes homelessness isn't just the folks that you see on the street, but there are a lot of people and families that are living in their cars. And there's a lot of judgment that people feel is going to be imposed on them from people that they interact with when they find out that they're experiencing homelessness. And it's something that we get to do is kind of help them feel like it's okay and we're understanding and we can help you through this situation, and being that support to help move them along in a way that's compassionate and empathetic and is there to serve.
Because I would think in Orange County, you could be one job away from not having a home anymore.
Yeah, and I think that through different periods of time across the nation, and certainly in Orange County, that's been something that we've seen. We saw it during COVID where the difference of a paycheck was a really drastic change for people. And there were a lot of supports that we tried to put in place for folks during that time, providing short bridges of some financial assistance to keep them from becoming homeless, or helping with the provision of food so that they didn't have to make a decision about, what the statement is, rent eats first. And so if food is something that we can provide so that they can allocate other resources to their financial resources to being able to pay rent or pay for gas to get to work, that's something that is hugely helpful for folks.
What's the website?
Our website is www.shareourselves.org.
And when they go to the website, what will they learn?
They'll learn all about the different services that we provide, and it's really easy to navigate. There's also a place there that if you want to volunteer, learn more about volunteering, learn more about our community programs or donating, that's available. But as well, if someone is in need of finding health services or wants to learn more about the other types of financial assistance that we can provide, navigation, case management, that's a great place. And we have a single phone number that people can call, and there are folks on that line that will be able to help them navigate.
And what is that phone number?
That phone number is 949-270-2100.
Now, when they call that number, are they going to get a person or are they going to get a recording?
They are going to get a person. So, yeah.
Okay. Thank you, Share Ourselves Chief Executive Officer Christy Ward, for being on Impact OC. And I thank everyone for tuning in. I'm OC Talk Radio Public Affairs Director Dawn Camber. Have an impactful day.
You've been listening to Impact OC, the only program showcasing the people and organizations shaping our community. Right here on Orange County's only community radio station, OC Talk Radio.